Good evening, everyone, and welcome to tonight's CPD webinar on electronic prescribing and the active script list. My name is Alex Woodiwiss, and I'm one of the Digital Health and Quality Improvement Officers at Central and Eastern Sydney, PHN. I would like to begin this evening by acknowledging the traditional custodians and sovereign people of the land across which we work. I recognise their continuing connection to land, water, and community, and pay respect to elders past, present, and emerging. I'd also like to extend that respect to any Aboriginal people who may be joining us tonight. Briefly, some housekeeping notes. If you could please submit any questions you may have to the Q&A function at the bottom of your screen, as the chat function is not enabled during the session. We have allocated some time for any questions submitted at the conclusion of the presentation. Post-webinar, an evaluation survey will pop up on your screens, and a post-training survey will be emailed to you also. I'd also like to bring your attention to some upcoming CPD events, including CPR workshops and cultural awareness training. Please scan the QR code to register for any that you may be interested in. There is also some information regarding nominations for primary healthcare awards, accessing support for your practice, urgent care centres in the region, My Medicare, including mental health centres, DFSV Assist, Mental Health Service Directory, and Health Pathways. Tonight, I am joined by my colleagues Grace and James from the Digital Health and Quality Improvement team, as well as Lauren from our CPD team. This webinar will focus on electronic prescriptions, their benefits, and the active script list. A PDF copy of the slides was sent to you in an earlier email. This will also be included in the post-training email, including the active links to relevant resources for you to refer to. Over to you, James.
Thanks, Alex. Welcome, everyone. So we'll first start off with what is electronic prescription. So an electronic prescription is an alternative option to paper prescriptions. Individuals and prescribers are still able to choose between a paper and electronic prescription. And they meet the Commonwealth, state, and territory legislations as well. And there's some additional resources as well at the bottom. So the benefits of electronic prescription. So it's to provide an alternative choice to paper. It's convenient, supplements delivery of telehealth, protects community members from exposure to infectious diseases. So around like the pharmacy and the general practice area, maintains privacy, reduces the risk of lost paper prescriptions, and reduces administrative burden for healthcare providers and organizations as well. The electronic prescription token looks like this on the screen. So you would have, it'll first start off with the first screen, which is your standard messages screen. Once you click into the text message, it'll show you the second screen. And then the third screen is pretty much when the prescription loads up on your phone in your internet browser. It will pretty much generate a QR code, which you then present to the pharmacy. So similarly, like the last screen, so this is the token before dispensing, which is on the left-hand side. It'll tell you the prescription name, so in this case, amlodipine. It'll tell you the milligram, which is 10, and it'll tell you how many tablets, which is 30. It'll also tell you the prescription date and how many supplies are remaining as well. And obviously the QR code. And then onto the second screen, if the token is no longer valid after dispensing, it will tell you that the prescription has already been dispensed. And then a new token will be sent to you from the pharmacy dispensing software, and it'll also tell you as well, in this case, it'll have one supply remaining. Onto the next slide. So this talks about expired, dispensed, and cancelled prescriptions. So on the left-hand side, it'll tell you that the prescription has already been has expired. The second one will tell you that the prescription has already been dispensed, if you've already retrieved it. And then the last one is if it's been ceased by the prescriber, meaning that the doctor has cancelled it. So electronic prescriptions and what can they be used for? So they can be used for the pharmacy benefits scheme medication, so those that are under the PBS, authority prescriptions, regulation 49 prescriptions, private non-PBS prescriptions, and Schedule A prescriptions as well. And additionally, as mentioned, they must comply with any state and territory legislation, as this is the case as well for paper prescriptions. I'll now hand over to Grace.
James. So now we're going to go over the active script list. So the active script list, what is it? It's a token management system. It is a consolidated digital list of patients' active electronic prescriptions and repeats that are available to be dispensed. Instead of presenting a token for supply of their medications at the pharmacy, patient can confirm their identity and provide consent to allow a pharmacy to access their own active script list, which is the consolidated list of their medications. However, handwritten paper prescriptions and computer-generated prescriptions that don't have a barcode will not be visible in the patient's ASL. A specific pharmacy can access a patient's ASL once they've been given consent by the patient. Patients can view and manage their ASL, their active script list, via conformant patient apps such as the My Health app. To do this, patients require an activation code from the dispenser in order to link the ASL to their script management app. And as of May 2024, there's only one conformant ASL product available, which is called My Script List or MySL, which is what you'll see in your dispensing software most often. Next slide. Thanks. So carers and agents, what are their role in the active script list? So patients may nominate a carer and or agent to manage their ASL on their behalf and collect their medicines. A carer is a person or organization who has the same ASL rights and access as the patient. For example, aged care homes may, with the patient's permission, nominate themselves as a carer so they can receive electronic notifications and provide site consent. And an agent is a person whom the patient has authorized to collect supplied medications on their behalf. A patient is responsible for getting consent from the carer and the agent and communicating to the healthcare provider that the consent has been provided. And next slide. So the first step in getting a patient on board with the ASL is registering them for the active script list. They then link their active script list with the script management app of their choice. So when a patient requests to register for the ASL, the registration process is initiated via the dispensing software, in some cases prescribing software, but at the moment, generally dispensing software. ASL functionality in the dispensing software is called MySL, and consent and access requests are sent to the patient using their preferred contact method. Usually this is SMS or email, during which they acknowledge and respond to the terms and conditions and privacy policy of using the ASL. So when a patient is registering for the active script list, it's important to explain to the patient that part of the ASL terms and conditions is that when a medicine is prescribed or a repeat is dispensed, it will be sent to the ASL by default. It will be added to the ASL by default, unless it is specifically requested that it's excluded from the ASL by the doctor or the pharmacist. Either the doctor or the pharmacist can do this. The registration process allows the patient's ASL to be pre-populated with all of their existing prescriptions if that's what they consent to during this process. Patient must grant consent to allow pharmacy or medical practice to access their ASL, and the patient has the options can respond to these requests, but with 3 options. Number 1, grant ongoing access. 2, grant access for the ASL, but only for 1 day. And 3, refuse access entirely. And so which prescriptions can be viewed via the ASL? Electronic prescriptions, unless they've been requested to be withheld from the ASL by the patient. Computer-generated paper prescriptions that have a barcode will also be visible in the ASL, but will not be available for dispensing without the paper prescription. So they do still need to have that paper script on them. Computer-generated paper prescriptions, which are dispensed manually by the pharmacist, i.e. they're not scanned, will not be updated in the ASL. And handwritten paper prescriptions and computer-generated prescriptions with no barcode or will be excluded as well. The ASL should not be, just a note, the ASL should not be relied upon as a complete list of medications that the patient's taking, as some of them can be excluded. So just keep that in mind. So how do patients use the ASL? A patient can request to register for the ASL at a pharmacy. Once they have registered for the ASL at the pharmacy, the patient can use an app such as the My Health app to manage their prescriptions. They may request an activation code from the dispenser. And once this code is entered into the app of their choice, like the My Health app, they can then link their ASL to that app, allowing them to view and manage their prescriptions in there. So now the patient's set up for the ASL, patient then attends the doctor's office and requests a script to be written for them. And patient requests that the script is done via electronic prescribing, and it is then added to their ASL by default, unless they ask for it to be withdrawn. The patient does not need the token because it's in the ASL, but they can have it if they wish. The patient then presents to their pharmacy, validates their identity, and receives their medicine, which was accessed by the ASL. Alternatively, they may present the token if they would like to use the token that they have either in their SMSs or in the app itself. If there are repeats of the script, they will be added to the ASL depending on the patient's choice. So, who benefits the most from using the ASL? Patients who have scripts on file. You don't have to, now the pharmacy can provide a scripts on file service, but electronically. Individuals who take regular medications, it removes the need for individuals to manage multiple tokens on their mobile devices, multiple SMSs, multiple paper scripts. And individuals that have lost a repeat token, if they are registered for the ASL, they're not required to produce the token at the pharmacy that they have given consent to. So it does remove a barrier there. Next slide, please. Thanks. And healthcare organizations that are enabled for e-prescribing must comply with 3 key policies: security and access policy, privacy policy, and data usage policy. Organizations should ensure that internal policies cover authorization protocols for employee access, suspension and deactivation processes for system access, required training before use of the system or assisting patients with the active script list registration, information security measures and risk management strategies, and verification steps for consumer identity when accessing or registering the active script list. Policies can be adapted or created independently depending on the organization's needs. So now that our patient is registered for the ASL, they want to link their ASL to the app that they're using to manage their prescription tokens. We need at the pharmacy to provide them with an activation code. So an activation code is a code that an individual needs to be able to link their active script list to the conformant app, allowing them to view and manage their ASL. If an activation code is next slide, please. Sorry. If an activation code is requested by an individual, a pharmacist, or a GP with conformant software, will need to first ensure that the patient is already registered for the ASL. If they're not yet registered for the ASL, please register them as per normal in the steps that we just outlined earlier. Then once they are registered, you can provide them with an activation code for the ASL. Please note that the ASL activation code is different to the code you would provide for your pharmacy's medication management apps. So I will go through how to generate that code. Where the code is displayed will vary depending on what software you're using. However, it's usually in your patient details or where you would typically view the patient's ASL. To generate the activation code, there will be a button or tab to select within the ASL screen. It may display as get activation code or my SL activation code or activation codes with some wording similar to that. On the next slide, I have some examples of what these activation codes look like in different dispensing software. So in blue, we have Fred Dispense. It's labeled as the Get Activation Code in MySL. Red, we have Minfos, labeled MySL Activation Code. And yellow, we have Z Dispense, labeled just as Activation Code. So now we'll go on to the, so we've talked about the ASL and the conformant apps that they can use. Now we'll talk about the actual prescribing. So here we have some extra resources if you haven't had a lot of experience in prescribing e-scripts. If we go to the next slide, I'll show you. So this is a screenshot from best practice. So we access the patient's medicine list. We go to the medicine that you want to send the token for. Go to the token drop down and choose from SMS, email, or paper, whichever the patient prefers. From there, you select the e-script tab on the side to send the token and double check that the patient or the carer receives the notification. This is probably a good time to also check and make sure that you have your patient's most up-to-date phone number and email. So successful delivery of a token by a prescriber. This is a message that you will get once you've sent the token. You'll know it's been sent because you'll get a little message. It's also best practice to check the patient and make sure that they have received it themselves. If the token is unsuccessful, on the next slide, oh, sorry, back one. Yeah, sorry, if something goes wrong. So if the SMS is unsuccessful, you'll get an error message appearing on your screen. Best to check before ending the consultation that the token has been sent so that you don't have to then follow up. And in the event of no error message and if a patient does not receive the token, it's best practice to check the patient's phone number and email address in the system to make sure that the token is being sent to the correct place. Okay. So that's for standard scripts. For PBS and authority scripts, it's pretty much the same thing. You follow the normal process for prescribing. Conformant prescribing software will allow prescribing medicines as a traditional paper script as well as electronically. So you just have to choose electronically. You go through the authority number process as standard, and then review prescription and choose the method of delivery. So similarly to the previous one that we just looked at, use this opportunity again to confirm the contact details of your patient. And that's how you prescribe the PBS authority scripts. I'll hand over to James, who will talk about S8s.
Thank you. So what is the process for S8 medications? So the Schedule 8 medication token EP does not replace other systems used when prescribing/dispensing controlled drugs or drugs of dependence. So such as the real-time prescription monitoring system, so example, SafeScript New South Wales. It may be a legislative requirement in some states and territories to have an authority/warrant number to prescribe restricted medications. So this number must be included in the electronic prescription as a separate field or can be put into the note to pharmacist section. A pharmacist would not be able to dispense such a medicine if the required authority and permit number is missing. So electronic prescriptions, like paper prescriptions, must comply with any additional state and territory rules as well. So on here, it's just a screenshot of one of the practice software, so you can see how to dispense the medication. So you can say the paper token here, which is selected for the e-prescription. You can also add the re-authentication required by the software, so it'll tell you to log in and you can authenticate the prescription as well when generating the S8 medication. And then here you can also add the authorization number as well, which is a standard process. And then also the normal process for prescribing as well. It'll just go through what the dosage is, the frequency, the instruction as highlighted, and then the purpose of action as well. And also the duration of the medication as well, and whether to send it to my health record as well. That's usually an option. And I'll now hand over to Grace again.
Thanks, James. So withholding prescriptions from the ASL. So how can we withdraw, how can a patient withdraw consent to their script being added to the ASL? So patients agree to their prescriptions being available in their ASL during the registration process. Therefore, it's the patient's responsibility to inform the prescriber or pharmacist if they want a script withheld from the ASL. We'll go through how to do that withdrawal just on the next page. Yep, perfect. So withdrawing consent, if a patient has chosen to withdraw consent to a certain medication from their ASL, then you have to comply with their choice. The doctor in this instance will need to select the exclude from active script list, or whatever the equivalent button is in your software. In this dispensing software, ASL consent box is checked as a default. Therefore, to withdraw, the doctor will need to uncheck and then save those settings. So this is how to withdraw a patient's consent in dispensing software. Pharmacist in this instant will need to select exclude from active script list or the equivalent wording. In this software, it has ASL consent checked and the withdraw consent for ASL. Checked, and to withdraw the consent for ASL, we would just uncheck that box. So it's pretty easy. And on to Alex.
Thanks, Grace. So to support a smooth and effective workflow for electronic prescriptions, here are some areas practice staff can assist with. Like we mentioned before, when marking a patient as arrived, confirm their email address and mobile number, in addition to completing the usual checks. Ensure all relevant team members are trained in the practice's electronic prescribing policies and procedure. Confirm the practice is registered with the National Prescription Delivery Service, also known as ERX, as electronic prescribing cannot function without this integration. It's important also to make sure that the latest version of your electronic prescribing software is installed and actively used. Next slide, please, James. As a prescriber, there are a few key responsibilities, which include adding annotations to an e-script for state-specific needs, confirming that token receipt before the consultation ends, reissuing tokens if misplaced, as well as cancelling prescriptions if no longer required, which disables the token altogether. Please note, dispensed prescriptions can't be modified or cancelled. Repeats may still be cancelled depending on the software that's used. So let's explore a few real-world scenarios that patients might encounter when using electronic prescription tokens and how we can respond effectively. Firstly, it's easy for a patient to delete an SMS, especially with auto-delete settings on the device. If this happens, they should call the practice and speak with the receptionist. Some possible solutions include the prescriber reissuing the token if it's the original script. If it's a repeat, however, the pharmacy may be able to resend it, as well as the patient being registered for the active script list, which will simplify access to these tokens. Secondly, if a token was sent to the incorrect or outdated mobile or email address, this may result in a failed token delivery. As stated numerous times before, patients should review and update their contact details during appointments and at reception. Prescribers must confirm the token receipt before the consultation ends or advise patients to call back once they've checked. If the token delivery fails, cancel the original and issue a new prescription with the updated contact information. Once cancelled, the original token is invalid and can't be accessed. If a patient doesn't have a smartphone, they can nominate a carer's contact to receive the token or request a paper prescription. Alternatively, consider registering them for the ASL, which removes the need for a token during pharmacy visits. Thanks, James.
Okay, so pharmacy staff responsibilities. So scripts in checklist. So to assist individuals with locating their token, so it'll be in their SMS under eScript SMS, or if it's being emailed to you, it'll be under your electronic prescription. So the sender should always be under no reply at emailprescription.com.au. If you're still having an issue finding the right token, if appropriate, you can offer the active script list registration, and then also complete the individual's details check as previously mentioned by Grace and Alex, and also confirm contact details for receipt of the repeat token. So the scripts out checklist. So confirm the individual has received the repeat token, which is usually sent to them either via SMS or email. Educate them on how to use the repeat token next time to avoid the tokens being accidentally deleted. Instruct the individual to contact the pharmacy if they need their repeat token to be resent, and educate them about the use of mobile apps or the active script list as well. So for electronic prescriptions, so the tips for pharmacists, so avoid automatically overriding individual details when scanning the electronic prescriptions as well. So for example, the doctor or receptionist may have got the details wrong. So it's always important and best practice, as Grace mentioned, to confirm the details with the individuals themselves. Check the electronic prescriptions from the full electronic prescription list on the screen. So these include annotations, so do not check from the token only. Active ingredient prescribing, so don't assume that the software will automatically choose the correct medication or brand. Always check that as well. For the software error, you need to report it to your vendor, so depending on what software you are using. And overall, it's still you still need to clinically assess the appropriateness of the medication for the individual as per standard practice as well. So dispensing electronic prescriptions. So we do have a few more resources as well when it comes to electronic prescriptions and active script list, and also active script list in community pharmacy as well. So when dispensing electronic prescription, we have an example of Fred. So will say here in the red boxes, so the new electronic prescription, it'll note whether you want to send it to the MySL, and it will also note any annotations as well, the repeat and the original as well. So confirming individuals' details and repeat preferences. So as previously mentioned, don't assume that the details are correct. It's always great to check with the individual themselves. So as highlighted here, you would have the email, and you can also choose the method of sending the prescription back. So as previously mentioned, email, SMS, or you can even print it in certain cases as well, depending on the preference of the individual. And this is just an example as well of resending a repeat token as well. So we have Minfos and ZDispense as well. So it'll pretty much tell you like if they want it sent by mobile or their email, or you can print like a evidence of it as well, which will have the QR code and their details on it as well. So you can hand that back to the patient as well. And I'll now hand over to Alex.
Thank you, James. Next slide, please. Okay. When accessing a patient's active script list, it's easy to distinguish between electronic prescription tokens and computer-generated paper prescriptions that include an ERX barcode. Both are visible in the active script list. However, paper prescriptions without an ERX barcode are handwritten scripts and don't appear within the ASL system. It's important to understand how paper scripts and electronic prescriptions are handled within the active script list system. So with electronic prescriptions, only electronic scripts can be directly dispensed from the active script list. Pharmacists can select these prescriptions from the ASL or scan the patient's token. The legal version of the prescription is stored in the PDS. Dispensing is verified using the on-screen display. No printing or physical copy is required. With paper prescriptions, although computer-generated paper scripts with an ERX barcode may appear in the ASL, they cannot be dispensed without presenting the physical paper script. The paper script is the legal document and must be retained for records. ASL will reflect the script and any repeats only if the pharmacy scans it during dispensing. Handwritten paper scripts and those without an ERX barcodes do not appear in the ASL.
So I am going to be speaking to you a little bit about the My Health app. So as mentioned before, there are many token management apps that are available and patients are able to use the one that suits them best. However, the My Health app is a brand agnostic Australian digital health agency app, which provides patients access to their ASL, their My Health record, and many more features. So the My Health app is an application which can be used by individuals to view key information in the My Health record. It's a secure and convenient way to view key health information that has been added to the My Health record by consumers or their healthcare providers. Consumers can also access electronic prescriptions and other things such as booking health services and more within the app. Next slide. So here we've shown an example of the home screen of the My Health app. So some of the features that a patient can or a consumer can use in the app, they can view their medical history, view and manage medicines via the active script list, manage allergy and reaction information in the My Health record. So if they do go to hospital and they've updated it, that's active, up-to-date information. Access immunization history, find pathology and diagnostic imaging reports, view, download, and share documents such as referral letters and specialist letters, and manage their organ donor register. So it's a pretty good app.
Thanks so much,
Um,
Grace.
yeah.
We would love to hear your responses to the 2 questions on the screen. If you could please pop your answers in the Q&A chat box, that would be much welcomed. So how are you, either GPs or pharmacists, currently promoting electronic prescriptions and active script list patients? And are there any educational materials you think that would be beneficial to increasing EP and ASL uptake among patients? I'll give everybody a few minutes to type their answers in the chat, and we'll also just look at the Q&A if there's any questions as well. Grace, can you see the Q&A questions?
Yes.
Did you want to speak to the e-script?
Yeah, so how to cancel an e-script and reissue an e-script if you've made a mistake or something has changed. Give me one. Let me have a look into that and get back to her.
James, can you see some of the other questions?
Let me have a look.
Yeah, Amy said posters and pamphlets. However, a lot of patients are aware about e-scripts now. Awesome. So, and patients have a lot of scripts and are struggling. Ah, okay, so Jenny said that they might appreciate a card or written information explaining it more clearly, and also how to log in, log set up the My Health app would be good. It takes a lot of time to do it with the patient. Yeah, it can take a lot of time, especially if the name is slightly different, or maybe the information doesn't match, or maybe they don't have a MyGov account organized yet. It can be a little bit tricky in the first instance. Yeah.
Amelia said if we can provide, if the PHN can provide education materials in languages other than English, would be beneficial to the patients. That's a good suggestion. And then Sydney said simple pamphlets with diagrams and instructions.
Mm.
Cool. Was there any languages in particular
Yeah.
that people, if we could be specific with that, that would be very helpful. That's a point that we can start. I know that there
Yeah.
is quite a diverse culture in our region, but for example, Bengali or Greek or something, that would be great to have that knowledge.
Mm.
Fantastic. Thank you, everybody, for participating in that discussion.
Just in regard to the cancel of the e-script and reissue the e-script, so for the original prescriptions, you would need to contact the prescriber, so it'll be the doctor, and then to cancel the lost token and request a new one, if it's a repeat prescription, you would need to contact the pharmacy in that instance, and then that dispense the original e-script, so then they can reissue the repeat token, as a FYI.
Yeah, and for the patients who are elderly or have an intellectual disability, they would have an authorised contact or guardian, legal guardian as well, that is able to act on their behalf, so they would be able to complete that registration process and engage a carer or authorised representative to act on their behalf. There's also a statement or question, providing a troubleshooting guide for e-scripts for GPs, please.
Yeah,
Certainly.
I can definitely get something together for that. Yeah.
Yeah, certainly. Wonderful. Thank you, everyone.
Okay,
Next slide, please, James.
Yeah. Okay, so these are the frequently asked questions as well. So what happens if I delete my SMS or email containing my prescription? So I'll just get up that. Did the screen pause? Sorry, it's just loading on my side. Okay, so as I was saying, what happens if I delete my SMS or email containing my prescription? So in that case, if your prescription has not yet been presented to the pharmacy, then your doctor can easily reissue you with a new SMS or email containing your QR code. So if you have lost an SMS or email containing a repeat prescription, then your pharmacy will be able to resend that code to you. And then moving on to the second question, so how does a pharmacy use the QR code to supply my medication? So in that instance, to access your medications, you will need to present the SMS or the email to the pharmacy, which contains a link to your QR code. And then the pharmacy would then go ahead and unlock your prescription and dispense that as per normal in whichever software that they have as well. Another frequently asked question is what happens if I don't like the electronic prescription? Can I swap to paper? That is a great question. So if your prescriber issues you with an electronic prescription and you decide you prefer paper, then the prescriber will need to be contacted to issue you with a new paper prescription. You can always speak to your pharmacist or your prescriber to ask for a paper version to be provided. And do GP clinics and community pharmacists need to contact to the healthcare identifiers service? So yes, the validation of the consumer's identity using the HI service is a mandatory requirement for electronic prescribing as well. And so the certificates and the security arrangements which are required to connect with the National Prescription Delivery Service. So the National Prescription Delivery Service establishes its own certificate and connection security approach to meet the conformance requirements. So if you do want to find out more information about that, you will need to contact the National Prescription Delivery Service. And they would be able to provide more information as well. We briefly touched over in the slide already about how Schedule 8 medications dispensed through electronic prescribing, but like I said, it will be according to state laws and legislation as well, and it's important to do that for those particular medications, especially Schedule 8s. And also, is it mandatory for my electronic prescribing software to provide electronic prescriptions to the Department of Veteran Affairs, so the DVA card holders? The answer is yes for that. So DVA card holders are consumers of electronic prescriptions. So the HI service supports the delivery of IHIs via DVA card numbers. So for more details regarding the DVA requirements, you can refer to the electronic prescribing conformance profile. And finally, can medication be dispensed when the HI service is unavailable? So when the HI service is unavailable and the IHI number cannot be verified, an electronic prescription can still be retrieved from the NPDS using a token, and a dispense record can be sent to the NPDS as well. So these are just some resources that we do have and the PowerPoint will be shared at the end of the night.
Next slide.
Oh, sorry, did it not change?
No.
Oh.
If anything else does jump out at anybody attending tonight too, if they have any questions for us, we'll open the floor now. Please pop your question in the chat. Or Q&A, sorry, I keep saying chat. I do understand that this seems like quite a lot of work for the dispensers and the prescribers, but it does streamline the process a lot and reduces human error. It's also great for the patient to keep handy like all those scripts rather than losing them here, there and everywhere. Some people that are on multiple medications too do get a bit disconcerted and a little bit uneasy about managing their multiple scripts and when is this due. So ASL does kind of keep that all together and combined, and eases the burden of managing those multiple medications. So yes, it will take time to get used to, but yeah, it is the way of the future, and it is trying to make it easier for everybody as well. Yes. So we do have some surveys. I know everybody is a little bit surveyed out, but we would really appreciate your feedback on this. Without feedback, we can't get your insights and knowledge on the ground of how things are working. So we really do encourage you to complete the survey if you can. I think it only takes two to 5 minutes to do.
Yeah,
It's
5 minutes.
very, very quick and easy. Yeah, and we really do appreciate it. Grace, did you have anything you would like to add?
No, I mean, yeah, it is just super helpful in helping us understand where your pain points are, where the bottlenecks are, you know, what are patients calling back after their appointment having issues with? What are the issues at the pharmacy level? So yeah, it just does really help us improve the service.
Are there any awareness campaigns that we need, more posters in either pharmacy or the GP practice that we can kind of assist you all with, or education? Yeah, we're always open to those ideas and to helping you all out. So I don't think there are any more questions. We'll stay here for a few more minutes just to see if anybody has any questions that they would like to add. And then we might get a bit of an early mark. Okay. Thank you everybody for attending tonight.
Yes, thank you.
Thank you so much.
Thank you, Grace. Thank you, James. Thanks, Lauren.
Thank you, Alex. Thanks, James. Thanks, Lauren.
Thanks, everyone.
Bye, guys.
Have a good night. And if you do have any questions following this that do come up, please do send us an email and we will aim to get back to you. Thanks. Good night, everyone.
Thank you.
Thank you. Have a good night.
Bye.
Bye. Bye.